Assalamu alaikum, good afternoon. Today, inshallah, we'll take rapidly most of very important topic, which is how to measure blood pressure. And at the end of the session, we'll see who measure blood pressure accurately. So please focus because this is very important topic. Okay? No need, inshallah. Because he knows the technique, but the protocol, no. So first, what is blood pressure? As you know, blood pressure is the force of circulating blood on wall of the blood vessel. It means that the heart contracts. When it contracts, it pushes the blood. So the blood pushed into the arteries, into circulation by a force. This force is the blood pressure. So if the heart is pumping strongly, it will push blood by a strong way. So the blood pressure will be high and vice versa. The blood pressure is measured in millimeter mercury, and this is very important because sometimes I see paper from the clinic. If you know, when you do chart for the patient to record it, and the sister makes a chart and right beside it, milligram per deciliter. So it's a disaster. The unit of blood pressure is millimeter mercury, mm, capital Hg. Okay, so this is very important. Okay, if you see in this animation, this is the heart. It contract and relax. Always late. Yeah, you can see. So this is the heart. It contract, so push the blood, and then relax to receive the venous return. The contraction of the heart is pushing the blood is the systolic blood pressure. And the blood pressure value while the heart is relaxed and the blood is returning back is the diastolic one. Okay? So systolic during contraction, diastolic pressure during relaxation. So which is powerful, the contraction or relaxation? The contraction or the relaxation? Again, for sure the contraction, right? So the systolic pressure is higher than the diastolic one. No, never we can measure diastole higher than systole because force of contraction is much more higher than force of relaxation. Okay. So blood pressure, we have systolic pressure, which is the maximum pressure during the heart contraction, and the diastolic pressure, which is the minimum pressure during the heart relaxation. These are very basic knowledge. Okay. Why it's important to measure blood pressure accurately? This is very important because if you measure the blood pressure in accurate way, you can diagnose patient that he is hypertensive while he is normal, right? So if you measure the blood pressure to be 150 over 100, and actually it's 130 over 80, so you put a patient to be a hypertensive, and the hypertension is a lifelong disease. So the patient will take medication for life, and the diagnosis is wrong because you measure the blood pressure in inaccurate way. So this is very important. And also it affects the treatment and patient outcome. When I give patient the medication and for hypertension, patient next visit come and you measure the blood pressure and tell me that it's still high. So I increase the dose of the medication. Then the patient develop hypotension, become drowsy, feel fatigue. So the treatment decision and doses modification depend on the measurement. So it's very important to measure the blood pressure accurately. I remember 4 years ago, I was attending in Paris the ESC conference about hypertension, and they asked about 10,000 cardiologists worldwide. Asked them about are they measure the blood pressure in their clinic accurately or not, and about 5% only was measuring blood pressure in the right way. So it's a global problem. Okay. As you know, we can measure the blood pressure using the sphygmomanometer, the mercury device, by the auscultatory method using our stethoscope. or we can use our automated digital devices, which depends on the oscillations of the blood pressure. So both of them are accurate. So there is a misconception that the automated device is less accurate than the mercury, but if the automated device is a good one, both of them is accurate. Okay. So what are the steps for measuring blood pressure? The first important thing is to explain to the patient the procedure to the patient. So you must speak with the patient a little bit to explain to him what will you do. Because sometimes if you, kid, you face it, when you put the cuff and start to inflate, then patient feel pain and then shout or feel discomfort. But if you tell him that will wrap the blood pressure cuff on your arm, will inflate it to a certain level, you may feel some pain of the inflation, so don't worry about it. So just speak with the patient to explain to him what will you do. This is very important. Okay. Second thing is that to ensure rest for 5 minutes. This is very important. يعني in our cardiology clinic in second floor. So it's not logic for the patient to come from ground floor to second, then sit and start measuring it. The patient must take rest at least 5 minutes. This is very important. And we'll tell you the details of this. The patient position. We'll know the proper position of the patient while measuring blood pressure. So you must put him in the proper position, as we'll see now. Also, you should choose the proper cuff size, and this is a disaster. You can imagine that in our cardiology clinic, we have only one size. This is very problem. When we have a female obese, then Renela puts the cuff on the arm, then the cuff open, then put it in the at rest, also it open. So for sure we measure it wrongly. So as we'll say, you must have 3 sizes of the cuff. The average one, the big size, and also the small size. So this is very important and affect you. You can imagine that if you have an obese female and use the usual cuff, you'll wrongly measure it higher by 20. So if their blood pressure is 130, you'll measure it 150. Yeah, you can imagine. So it will make a big difference. And also the cuff should be at the level of the heart, as we'll see now. The first important thing is the room for measuring the blood pressure. The room should be quiet and like this room. So you know this for dermatology. So you can imagine that a study showed that if the room has too much light, it increases the blood pressure by 5, just because of the light is too much. And also if there is a lot of noise, if the room is too much cold or too much hot, all this affects the blood pressure measurement. So the room should be with romantic like this, quiet light. As the echo, while we do the echo, we switch off the light so patient is relaxed. So light should be in good state. The temperature should be not too cold, not too warm, and no so much noise. This is very important. Yeah. Yeah. Just can
I will tell to Marwa to handle that.
Yes, yeah. We could just take another maximum 20 minutes, inshallah. Okay. So the second thing is the position of the doctor and the nurse. When you measure the blood pressure, you must be sitting. All of you measure it while you are standing. This is wrong. You must be sitting like this, and also keep your eye contact with the patient. If you use the mercury one, your eye should be at the level of the mercury column. So it's most very important to measure it while you are sitting. That's why we'll make a new setting in our clinic, inshallah, for good position for the sister and good position for the patient. So for you, it's you must measure it while you are sitting in a comfortable position and keep your eye contact. If you see in casualty 30 patients or 40 patients, and also you lean forward to measure it, you'll at the end of the day have back pain and you are not comfortable. You want to do it fast to finish it, so it's better to be in comfortable position. But what about the patient? The patient, as we said, should has a complete physical and emotional rest for at least 5 to 10 minutes. So if he is climbing the stairs, he must take a rest for 5 to 10 minutes. If he is get in trouble with the reception, also calm him down till the stress relief. This is very important to avoid smoking, avoid eating, and emit your bladder for at least 30 minutes. So if the patient is smoked recently, must stop smoking for at least 30 minutes. If he has full bladder and want to do urination, which make him feel stressed, he must emit his bladder. And also, if he's eating recently, must at least 30 minutes avoid it. And this is very important to explain at first to the patient that while you are taking the blood pressure measurement, he should stop talking. So, many patients, while you are taking his blood pressure, speak with the doctor, speak. So, at first, when you tell him that while you are measuring the blood pressure, he must stop speaking, he will obey your command. Okay, this is very important. So, this patient is happy and not in stress. Okay. Okay. So the correct position of the patient. The patient must be seated. His back must be rested on the back of the chair. His legs should be rested on the floor. He should not make leg crossing. And his arm should be supported at level of his heart. So this is the best position for the patient. To sit like this. Sit. His back is supported. Okay. His legs are on the floor. He don't like leg crossing, no, because this increases the blood pressure. You can imagine his arm should be like this, supported at the chair, and now the arm is at the level of the heart, so it should be like this. Okay, if you measure while his arm is not supported, this make contraction, spasm of the arm muscle, so it will press the artery and give you false low reading. So the arm should be supported and relaxed. This is very important. And when it's put like this, it will be at the level of the heart, not too low, not too high. Okay, this is very important, the patient position. Every step in this can affect the blood pressure and give you wrong measurement. This is the cup size. You must have the 3, and I suggest that we must bring these sizes. This is the average one for most of the patients, but we must have a large cup size for the obese one and a small one for children and for thin people. So we must have the 3 sizes. And according to guidelines, the cuff bladder, which is the rubber part in the cuff, should be at least 80% of the arm circumference. So, by roughly you can assess it. If the patient has a big size of his arm, you use the large one. If it is average, the average size. If he is very thin, you use the small one. So this is very important because it affects the blood pressure wrongly. And this image is very important, and I suggest we can print it as poster and put it in all clinics, which is the top 10 steps or advices for correct measurement. So first thing, ask the patient not to speak while you are measuring the blood pressure. His arm should be, use the proper cuff size, put the cuff on bare arm, and this is very important. Never measure blood pressure over clothes. It's very big mistake. Never measure the blood pressure over the clothes. It will give you, it will add 5 to 50 millimeter mercury abnormality. It will give you very false measurement. So it's very bad. Never measure on over the clothes. The arm should be supported and at level of the heart. Legs, no cross leg, and should be supported over on the ground. His back should be supported on the back. He must emit his bladder and avoid talking, speaking, eating, and smoking for at least 30 minutes. So these are the steps you must follow, inshallah.
If the bladder is empty, it will 10 mm of HG, it will be down.
Yes, because the full bladder make his patient to be a little bit anxious. So increase the sympathetic tone, so it give you a false higher measurement. So he must be relaxed at all levels. Okay. Steps for auscultatory method, for all you know how to measure it. As you influence, start using the palpatory method. till you feel that pulse is disappeared, then increase 20 to 30 millimeter mercury above the palpatory value, then start to deflate it slowly till you hear the first sound. This is the systolic. And the second important point back, while you are decreasing, the sound will be muffled, lower, 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 then disappear. Some of you take the lowering value as the diastolic value, but the accurate one is the disappearing sound. So instead of the sound gets slow at 90 and disappear at 80. So the diastole is 80, not 90. In order not to make all patients have a diastolic hypertension. Okay? So on the diastole, we depend on the disappearing sound, as we'll see in this image. Yeah. This when you increase it, say the blood pressure systole is 20, you increase the up to 140, so no sound. Start to decrease. The first sound you hear, this is the systolic. Then the sound go down, go down, go down. When sound disappear at phase 5, no sound, this is the diastolic. Okay? So systole at phase 1, when first hear the sound, and diastole when no sound at all. Okay, this is very important in order to measure it accurately. Okay, so common errors we can do is patient to talk while measurement, انك put the cuff over the nose of the patient, use abnormal cuff size, and the patient not at rest during the measurement, not rested. Finally, we have a rule of 2 in order not to forget. And this is the protocol I hope we bought. Okay? So now we'll go up and see the patient. How can we measure the blood pressure? First thing, so if the patient, this is his first visit to you, you must take 2 measures, one from the left arm and the second from the right arm. Which is higher, left or right? Left or right? Left side. Oh. Who's taking? Say left. Raise your hand. Yeah. Okay. Who's right? No. Okay. Look. If this is your feedback. This artery called from the aorta called is the subclavian. Subclavian, which go to the arm, which we measure the blood pressure. Okay, this is the left subclavian. The right subclavian go from a bifurcation. So this artery called the brachiocephalic is divided into subclavian right and common carotid. Okay, so the left one has direct continuity to the heart, but the right one has long distance and a lot of kinks. So usually the blood pressure is higher in the right by 10 because there is a lot of kinks and lower in the left by 10. This is the usual, you can say in 70% of persons. But some persons has the reverse. Left is higher than the right. So we cannot suspect it. In the first visit, you measure the one from left side and one measurement from the right, and decide that for the patient is his left is higher or the right. Say the left is higher, then you repeat the measurement twice. So I know him that his left side is the higher one. I take second reading after 1 minute and third reading after 1 minute. So say the first reading, yeah. So let's make it. This is the left and this is the right. I found here 130 over 80 and here 120 over 70. So خلاص, this right? No. So in repeated visits, I only will measure from the left. That's why you must document it for the patient. Okay? So I take another measurement on the left. So I found it at 140 over 90 and 130 over 80. So I take the average one. So his blood pressure is 130 over 80. Okay, this is very important. So this is the protocol. So we measure 2 arms and we take another 2 times from the higher one. For sure, you use 2 methods: the palpatory and the auscultatory method. And also we depend on 2 visits. If the patient came and he has a trouble with his wife, so this visit his blood pressure is high. In the second visit it will be low. So always we take the blood pressure for 2 visits in order to make sure that it's high. In 2 places, it means we have the home blood pressure measurement and the clinic. Some of our patients has what's called white coat hypertension. So anytime he measures the blood pressure in the clinic, it is high. If he measures it in home, it's normal. So always we advise the patient also to take blood pressure at home to decide if he has white coat hypertension. Instead, he can put the ABB monitor to make a chart for it to diagnose it. And we should measure from legs. Some special, but this is for cardiology only. Sometimes I can ask the sister to measure the blood pressure in the arm and measure the blood pressure in the leg, because we have some abnormalities. It can make the blood pressure in lower limb in the leg is very high than the arm, and the vice versa. We can diagnose certain diseases, but usually no, we don't do this. And also in 2 positions, I mean that you measure the blood pressure for the patient while he is sitting, and you take another measurement after 2 minutes of walking, standing, you take it. Why? There is some patients has what's called orthostatic hypotension, which patient whose blood pressure while he's sitting good, but if when he stand he feel dizzy and drowsy, so his blood pressure get low when he stand. When I suspect orthostatic hypotension, I take blood pressure measurement while sitting and while standing. And if the difference is more than 30, then the patient has orthostatic hypotension. He needs special medication and sometimes elastic stocking to push the blood up, so we can diagnose disease. The last 2 things, this only for cardiology. But for you, for all of us, we must follow this. When the patient came, take 1 reading in, left side, and 1 reading in, right side, and decide which is higher. Okay, you can. And if the left side is higher, so take second and third reading and take the average of them. And follow the general recommendations as we said. The position, the room, and the patient. Okay? These are the values of the blood pressure when it is normal, when it is hypertensive, no problem. And this is to finalize. So I'll ask, you can tell me what's wrong in this image?
Crossing the leg, talking on phone,
Yes.
and the position.
Yes. The sister is standing and not sitting. Okay.
The level of the arm.
Yes, he is speaking in the mobile.
The level.
The level of the arm is lower, not at the level of the heart.
Is there any measurement of arm, means the lying position? Is there any measurement?
For
We
what?
need to. The cuff.
Yeah.
The BP cuff should be like.
Should be 40 and 80.
40 and 80.
But we can make it roughly. Not every patient I give the meter, two finger breadths. Yeah, 2 finger breadths above the elbow, and the rubbers should be on the medial side over the arm. Okay? And also, I think she is putting the cuff over the clothes, and this is also wrong miss. Okay.
The position also the cuff should be.
Yes, it should be high, a little bit high. Yes. And what about this one? Also put the cuff over the clothes, and he is standing. The arm not supported, right? So this is wrong.
The position of the
Yes, also stand. And also here the arm not supported, and also he is standing. All this. Yeah.
It's opposite side. That is.
Yes. Oh yeah. Standing on the opposite side. So do it right from today. From today, we must measure the blood pressure in accurately.
Doctor, I have.
Yeah. Yeah.
What if the cuff is the patient is too much and the cuff is not really?
You tell him that we cannot assess your blood pressure.
So in what way we will
Bring the large size one, because we have sizes. If you have the large one, it can measure even the very obese one.
Is there any other part of the body we can check the BSP?
No. So when you measure it at rest, it's not accurate at all. It will be brachial. Yeah. Yes. Yes.
Maybe I give you.
Okay, any other questions? Good. Thank you.
Thank you so much, sir.
Welcome, welcome to me. Just stop.